So one of the more advanced techniques that we do in interventional pain management is something called spinal cord stimulation. This is a procedure that we save for people that are in chronic pain, and for a variety of reasons. Typically it's going to be someone that may have had a back surgery in the past, and unfortunately several years later are still suffering from sciatica and back pain. One in particular patient came in within the last few months to my office, and we did utilize this therapy for that patient. So he had a history of degenerative disc disease in his spine, lots of arthritis in his low back. We did go through a series of, I guess you could say, more conservative treatments in the office, some nerve blocks. We did something called a rhizotomy as well. And unfortunately, the patient just continued to suffer with back pain and was really looking for alternatives to opioid medications for his pain. Basically, with this therapy, what we did bring this patient in for was a spinal cord stimulator trial. So what we end up doing is through utilizing the fluoroscopy machine and epidural access in his back, we take a needle and we are able to feed a catheter into his spine. And so this is showing kind of a picture of that, where the leads are placed into the midline of his back here. And then this is a side view showing the leads in his back. These are placed temporarily in his back for about 3 to 5 days, and then he's able to go home and turn this device on. The way this technology works, it's like a pacemaker for the spine, is what I would kind of simplify this as. We block pain signals that are coming from the legs or the back that go to the spinal cord, then up to your brain. So if we're able to block those pain signals in that area, the theory would be that your pain would be drastically decreased. And so the goal would be a 50% reduction in either your low back pain or lower limb pain.
I had all the confidence in the world with the procedure and what he was doing. So you could lay on your stomach, then they would numb it up for the pain, and then they would take and slide a needle up the spine to the certain area, which he showed me the cord that was going up there, explained how it would work, and what I could do with the unit itself, and then taped me all up and sent me home. The procedure was very well done. It was very easy, not much time at all. I mean, it really surprised.
And he made it very comfortable. There was no agony or anything.
No problem with that. I mean, you always get your pains from needles and stuff like that, but other than that, that's the worst part, is just getting a needle for a pain.
He came home and he was sore from where the needles had gone in. But I mean, he was up and around and there just wasn't any pain.
So again, to reiterate, this is a temporary spinal cord stimulator trial that was performed here in the office. The patient did get greater than 80% relief actually in his back pain and leg pain following the procedure. And so at this point in the process, he's being scheduled now to be implanted with this device. That procedure will be done in either a surgery center or a hospital. It is an outpatient procedure, so it's a fairly quick procedure that can be performed there with anesthesia. And the only difference is there is a battery that's placed in the low back on the right side of the left side in the flank that can be placed there with a small incision that can be replaced down the line if it needs to be, but it's similar to a pacemaker battery. So spinal cord stimulation is something that we utilize here at Pohlman Pain Associates for our patients that do have chronic pain for greater than 6 months, that have tried other conservative options, even other injections that may just not be working for them. It's also an option for people that have had surgery before, especially in the lumbar spine, the low back, and unfortunately are still suffering from pain in that area. And this is something we can offer here at Pohlman Pain Associates for our patients.